Since the presidential declaration of the COVID emergency earlier this year and the subsequent, as we've talked about before, universal declarations, meaning all of the other 50 governors did the same thing, lockdowns on business, travel, gatherings, and churches have become the policy of choice by many, many. And certainly, the nations of the world pursued lockdowns as the way to go. Most of the world was locked down for some point in time, and the results actually have been and are increasingly evident. They are devastating. Increased starvation, the expectation for famine across Africa in particular is happening. Hundreds of thousands of businesses have closed forever, with an expected here in the United States, numbers I just saw, by the end of the year, expected 500,000 was the number that I read. Restaurants alone will be closed forever by the end of the year. Then just a few days ago, the World Health Organization released a statement seemingly condemning lockdowns as a policy. But the question is, what did they actually say? In the end, I asked what difference does it make what they said? Twila, a lot of people got excited and hopeful with the words from the World Health Organization seemingly condemning lockdowns to control COVID. But the World Health Organization, they're the first ones to help to create the panic in the first place, and they've regularly contradicted themselves along the way. So what did they actually say?
The WHO, we give way too much money to the World Health Organization given what has all transpired here. But what the doctor who was representing the World Health Organization said is they don't believe in lockdowns as a primary means of control. And I know that for most of the public out there, you sort of like gloss over those words and go, yay, right? But clearly they're saying primary. And it's really important to look at that word, which means that they do support lockdowns. They still support lockdowns. They say that lockdowns should only be used to have time to regroup, to reorganize, to rebalance, to take pressure off of the healthcare system so that doctors and nurses are relieved who are exhausted, that sort of thing. But they're sort of like threading the needle. They're not saying they don't support lockdowns. They are saying that they want more of the mandates so that when the lockdown comes off, there's the peak doesn't keep going up. So I don't really think that they're opposing lockdowns per se. They do say things like, it's making the poor poorer, and that's correct. It's keeping people from getting cancer screenings, and that's correct. And so I think they might be threading the needle here in order to make themselves look good, but they are absolutely not saying no to lockdowns. They're still supporting lockdowns